Hello, everyone. Today, we'll be discussing how to assess Ashcroft score in bleomycin-induced lung fibrosis model. Before we get into today's topic, I'd like to briefly introduce who we are and what we offer as a specialty non-clinical CRO. We are a Japan-based non-clinical CRO. We specialize in inflammation, fibrosis, as well as oncology, pharmacology studies. Our headquarters and lab is in Tokyo, Japan. We also have an office in California to support clients in the US. With over 1,000 of current client base, almost 90% repeat rates, we are proposing clinical-based approach by offering clinically relevant disease models as well as strategic designs for our clients. Okay, let's get into today's topic. Bleomycin-induced pulmonary fibrosis model is the most established non-clinical disease model for the investigation of the efficacy and mechanism of therapeutic candidates for lung fibrosis diseases in human patients. In this model, bleomycin is administered once at day 0. There is an onset of acute inflammatory response lasting up to 8 days, followed by fibrogenic changes resulting in deposition of matrix and distortion of lung structure out to 28 or 35 days. From day 0 to day 7 is an inflammation phase. The spike of inflammatory cytokines such as interleukin-1, interleukin-6, interferon gamma, and TNF-alpha. After day 9 is considered fibrosis phase, and the TGF-beta, fibronectin, and pro-collagen-1 are increased in this stage. Treatments during the first 7 days would be considered preventative, while treatments during the late stage after day 7 would be considered therapeutic. Here's a list of candidate drugs for pulmonary fibrosis currently in clinical trial. These compounds are tested in bleomycin-induced model in the preclinical stage. For the treatments of idiopathic pulmonary fibrosis, there are only 2 drugs that are in the market right now, which are nintedanib and dexamethasone. Compound by Boehringer Ingelheim, which is a PDE4B inhibitor. This is drawing attention to be the 3rd drug to enter the market. Their phase 3 clinical trial was initiated in October 2022. This compound also was tested with a bleomycin-induced model in the preclinical stage and have shown promising effects. In clinical setting, lung function tests are incorporated to evaluate the function of lungs and severity of lung fibrosis. In mouse study, however, this could be challenging. Oftentimes, Ashcroft score is used in preclinical stage. This method is established by Dr. Ashcroft in 1988. It has become a standard method for grading lung fibrosis, has a scale of 0 to 8, depending on the histological features of disease progression. Ashcroft score is graded using Mason's trichome staining. Collagen is stained blue, nuclei is stained dark red to purple, and muscle tissues are stained red to pink. Blue arrow shows bronchial tube. Pink asterisks are examples of fibrotic foci. Yellow circles are inflammation cell infiltrations. Histological staining of each stages looks like the picture shown here. Score 0 is normal lung. Score 1 shows minimal fibrous thickening of alveolar or bronchiolar walls. Score 3 is moderate thickening of walls without obvious damage to lung architecture. Score 5 is increased fibrosis with definite damage to lung structure and formation of fibrosis. fibrosis band, or small fibrous masses. Score 7 is distortion of structure and large fibrous areas. Score 8 is total obliteration of the lungs. Score 2, 4, 6 is in between stages. Score 7 is this. Yes, I've already mentioned that. Score 7 is a distortion of structure and lung fibrosis area. Score 8 is a total obliteration of the lung. And these are the examples of the staining. Next, we are going to see if Ashcroft score is correlated to other parameters. This shows that the more body weight decreases in mice, the severe the Ashcroft scores are in fibrosis phase in this model. The decrease in body weight and increasing of Ashcroft score has close correlation. At SMC Laboratories, we offer CT scanning in our IPF model for observation of fibrotic regions, usually on day 14 and day 21. These are the comparison correlation between the Ashcroft score and Hounsfield unit obtained by the CT scan. Lung hydroxyproline and Ashcroft score has a relatively weak correlation in comparison to body weight change and CT imaging. A problem with Ashcroft scoring is that grading is loosely defined, especially in even number stages such as 2, 4, 6, and the result could vary depending on the pathologist performing and his or her self-defined values. So we use modified Ashcroft scoring method, which has a more defined grading scale. Here's a comparison result from grading the same mice with both methods. Modified Ashcroft scoring method tends to score slightly higher than Ashcroft, the standard Ashcroft score. We have extensive knowledge and skills to perform idiopathic pulmonary fibrosis model, IPF model. We have done over 100 studies with this model, and we can offer 2 positive controls: dexamethasone for preventative study and nintedanib for therapeutic study. Modalities that we have experienced with are shown here, mostly small molecule, some antibody, peptide, nucleic acid, and cells. Also listed here are some of the therapeutic targets of compound we have tested. Here we will look at some parameters for our IPF model. We evaluate fibrosis area by serous red staining, produce quantitative analysis based on the positive area. Here's a sample for alpha SMA immunostaining. Alpha SMA positive area is significantly increased on day 21. The potential mechanism of endothelial cell involvement in fibrosis is their ability to transform to myofibroblasts during fibrogenesis. Myofibroblasts are fibroblast-like cells expressing alpha smooth muscle actin, SMA, and are among the primary effector cells in tissue remodeling and fibrosis. And lastly, here is a H&E staining of this model. Lung injury score is increased by 3 to 5-fold compared to normal group. The lung injury score ranges from 0 to 4, respectively, representing no damage, mild damage, moderate damage to severe damage. This is all for today. Thank you. You can contact us through our company website. At SMC Laboratories, we are hoping to create new value through preclinical experiments by suggesting effective translational data from clinical to preclinical study correlation. Thank you.